Hello, this is Dr. Sagar Srinivas, lead consultant in anesthesia, critical care and pain medicine at United Hospitals, Jayanagar. So, have you heard about an awake craniotomy? So basically it is an awake brain surgery, and let me go through the procedure, how we go about it. So let us divide it into few phases. First is the pre-operative counseling. So the first thing is, many people in the common public are not aware that anesthesia for any surgery, whether it is a minor or a major surgery, is provided by a qualified doctor called as an anesthetist. So they get trained after their MBBS for an MD anesthesia for a duration of about 3 years. So this is how it goes. So the role of the anesthetist goes from pre-operative evaluation of the patient, look for any risk factors they have based on their age, what surgery they are undergoing and other things, and then counsel the patient how the procedure is going to be and what is the way in which the pain during the surgery and after the surgery will be managed. That is the first part. So here in cases of awake brain surgeries, it is very crucial that we communicate with the patient and the family. One thing is because they'll be very anxious that they have a brain tumor, and second thing is, when these brain tumors are very close to critical structures in the brain, it needs to be addressed very carefully during surgery so that they do not lose any function of the brain post surgery. So we counsel the patient during our pre-anesthesia evaluation, and we tell them how we do it. So basically, for an awake brain surgery, we will block all the nerves in the head so that the complete head is numb. And when we are doing this also, patient will be kept on some sedation so that they are comfortable. And once the surgeon reaches the brain tissue, there will not be any pain. So we will come down on the sedation and make them awake in between surgery. So that is why it's called as an awake surgery. And it is very crucial for these kind of cases because the tumor, when it is very close to the speech area or the motor area, speech area is which will allow us to speak, and the motor area is the one which will make us do the hand and the leg movements. So it is very crucial that we monitor during this phase, and the patient himself or herself will be a part of the surgery. They are a part of the team because they will guide us where to go and where not to go when we are handling the tumor. So it is a very good or a sophisticated technique, awake craniotomy, using a nerve block and a sedation, and it requires a lot of expertise from the anesthesia perspective and the neurosurgical perspective, and not commonly done at all places. So one more advantage of this procedure is we are monitoring all the patient movements, speech and other things live, so that we can make sure that no part of the normal brain tissue is removed or damaged during surgery. And also, because we are able to avoid a general anesthesia, the complications related to general anesthesia can be avoided, and patient himself can have a early recovery and early discharge. So that is how useful or how critical providing an awake anesthesia for these kind of surgeries. Post surgery, the same day the patient is made to walk, have food and communicate and do all these things. So few other things about awake craniotomy. So can it be done everywhere? No, only a few hospitals in India are able to do this procedure. The reason being, it needs advanced training for the anesthesia team, the neurosurgical team, to handle such critical cases. And also, along with the training, it has to be supported by the necessary and relevant sophisticated monitoring devices, equipment, and also the drugs what we use to provide such a type of anesthesia, which is now available at United Hospitals Jayanagar. And in fact, this is the second case we are doing in the last 1 week, awake craniotomy, where the tumor was very close to critical structures in the brain. So even today we have used latest anesthesia molecule called as remifentanil, which was recently introduced in India, and this molecule gives a very good recovery and early sedation and early recovery, so that the patient can be given sedation and being comfortable throughout the procedure, and immediately post procedure patient can talk. Patient can talk even during surgery, right immediately after procedure, doesn't require any general anesthesia, and patient can be discharged prior to our regular general anesthesia or a neurosurgical technique.
I'm Dr. Sanjeev CC, senior neurologist practicing in Bangalore and also in United Hospital. We have a patient of special importance, so-called glioma tumor, which is occupying the eloquent areas of the brain. Glioma means it's a brain tumor. It constitutes nearly 1.6% of all the cancers in the human system. Glioma usually affects the brain. There are two types of glioma. One is low grade, another is high grade. Usually high grade are common in elderly people above 50-55 years of age. Low grade usually common in younger individuals, say between 20-40 years of age. In this patient we are operating on a low grade glioma. Usually the prevalence rate is 5 to 10 per every 1 lakh population. Why is this important today's surgeries? It is affected the important area of the brain. That means eloquent area of the brain, where power, speech, language is centered. So it has affected that particular part of the brain. That's why we are doing a special surgery called awake surgery under local anesthesia. The main aim is to preserve the function, at the same time remove the tumor as much as possible. Preserve function means power. You should preserve the power, hand and leg power. Speech area you should preserve, able to speak, able to understand. Then sensation you have to preserve. This is usually done with a special technique called mapping, cortical mapping of the brain, with specialized intraoperative neurophysiological electrical stimulation, followed by mapping of the important area of the brain. So the surgeon will take out the tumor, preserving the important area of the brain. So it requires a lot of skill, and at the same time it requires a lot of experience to do it. I hope you got my message about this tumor today.
So this young man presented with a history of seizures, and his MRI showed lesion on the left side, tumor on the left side of the brain, which is in the frontal area, in fact in the posterior frontal area. Left side posterior frontal is speech area, through which we speak, motor speech area, or also called as Broca's area. Surgery in this location, if the tumor is invading the Broca's area, can lead to permanent aphasia, or patient may not be able to speak at all. So awake craniotomy was used for this case, and during surgery patient was continuously talking, telling his name, counting numbers, and talking about all other things.
Yoraj.
Okay, where is your house?
Vijayanagar, sir.
Okay, can you count from 1 to 10?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Can you count in reverse, 10 to 1?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay.
Here we could see the entire margin, normal brain margins, and throughout the patient's speech was intact. This is how awake craniotomy helps in preserving the function and complete excision of tumor.
So we are done with the awake brain surgery, and here is our patient, Mr. Yuvraj. ಹೇಗಿತ್ತು?
ಸರ್ ತುಂಬ ಭಯ ಇತ್ತು. ಆದರೂ
ಸ್ವಲ್ಪ ಬಿ ಎ ಲಿಟಲ್ ಲೌಡ್ ಅವ್ರಿಗೆ.
ತುಂಬ ಭಯ ಇತ್ತು, ಆದರೂ ಬೇಗನೆ ಒಂಚೂರು ರಿಕವರ್ ಹಂಗಾಗಿ.
ಸೊ ಪ್ರೊಸೀಜರ್ ಮುಂಚೆ ನಿಮ್ಗೆಲ್ಲ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ವಲ್ಲ, ಆಗ ಭಯ ಕಡಿಮೆ ಆಗಿತ್ತಾ ಸ್ವಲ್ಪ?
ಹೌದು ಸರ್, ನೀವು ಹೇಳಿದಲ್ಲಿ ಒಂದು ಸ್ವಲ್ಪ ಧೈರ್ಯ ಬಂತು. ಆಮೇಲೆ ಅಲ್ಲಿ ಮಾಡ್ತಾ ನಮಗೇನೆ ಒಂದು ಸ್ವಲ್ಪ ಧೈರ್ಯ ಬಂತು.
ಸೊ ಆಕ್ಚುಲಿ ಏನಂದ್ರೆ ಯು ಆರ್ ಆಲ್ಸೋ ಅ ಪಾರ್ಟ್ ಆಫ್ ದ ಸರ್ಜಿಕಲ್ ಟೀಮ್. ನೀವು ಮಾತಾಡೋದು ಮೂಮೆಂಟ್ಸ್ ಮಾಡೋದ್ರಿಂದ ನಮಗೆ ಇನ್ನ ಈಸಿ ಆಯ್ತು ಟು ರಿಮೂವ್ ದ ಟ್ಯೂಮರ್ ಮೋರ್ ಅಕ್ಯುರೇಟ್ಲಿ. ಸೊ ಇವನ್ ಯು ಆರ್ ಅ ಪಾರ್ಟ್ ಆಫ್ ದ ಟೀಮ್. ಸೊ ಐ ಹೋಪ್ ನಿಮ್ಗೆ ಏನೋ ಸರ್ಜರಿ ಟೈಮಲ್ಲಿ ದೇರ್ ವಾಸ್ ನೋ ಪೇನ್ ಆರ್ ವೆರಿ ಡಿಸ್ಕಂಫರ್ಟ್ ವೇರ್ ಯು ಹ್ಯಾಡ್ ಟು ಡೂ ಸಮಥಿಂಗ್.
ಇಲ್ಲ ಸರ್, ನಿಮ್ಮ ಸಪೋರ್ಟ್ ಇದ್ರೆ ಧೈರ್ಯ ಮಾಡಿಸ್ಕೊಂಡೆ. ಎಲ್ಲರಿಗೂ ಥ್ಯಾಂಕ್ಸ್ ಸರ್.
ವೆರಿ ಗುಡ್.
ಆಲ್ ಆಫ್ ಟೀಮ್.
Very good. And again, you are very brave and very supportive. That also played a major part for us to do the procedure, because I told you before, usually all these surgeries are done when you are completely unconscious.
Yes, sir.
But because the tumor was very close to the speech area, we had to be very careful so that your speech part is not lost, or we retain the your voice and other things.
Thank you so much for all the team, sir.
So ಏನಂದ್ರೆ these kind of procedures are not done everywhere, because it needs that equipments agli, training for the surgeon or for the anesthesia team to do it.
Yes, sir.
And it's not very common to have the tumor close to the speech area. So ಏನಾಗುತ್ತೆ, many people are very anxious, as you said, and not they will not have anyone to speak to them or tell them what the procedure is, not to be scared, that kind of a thing. But you did very well. Surgery also went very well. All the tumor was removed. So some credit will go for you also.
All team, sir.
So once the tumor was completely removed, I told your wife also. She was waiting outside. Everything went well, and she said she was okay. We will call her also. You can speak with her, how you felt. You can tell her. I think she was more anxious than you, alva?
Okay, sir.
So anything else you wanted to ask me? Nothing. You're just happy that everything went well.
That's all.
Okay, so now only smiling, no crying. Okay, everything has went well, so no need to worry. Okay, ಫೈನ್. ನೀವೇನೋ ಹೇಳ್ಬೇಕಂದ್ರೆ ಹೇಳ್ಬೋದು. ಅದೇ ಹೇಳ್ತಿದ್ದೆ, ಸರ್ಜರಿ ಮುಂಚೆ ಯು ಆರ್ ವೆರಿ ಆಂಕ್ಷಿಯಸ್, ಅದಕ್ಕೆ ವಿ ಹ್ಯಾವ್ ಟು ಡೂ ದ ಕೌನ್ಸಿಲಿಂಗ್, ಹೌ ವಿ ವಿಲ್ ಡೂ ದ ಪ್ರೊಸೀಜರ್. ಫಾರ್ ಪೀಪಲ್ ಇನ್ ಅ ಮೆಡಿಕಲ್ ಬ್ಯಾಕ್ಗ್ರೌಂಡ್, ಅವ್ರಿಗೂ ಇಟ್ ವಿಲ್ ಬಿ ಸ್ಕೇರಿ. ಫಾರ್ ಪೀಪಲ್ ವಿತ್ ಅ ನಾನ್ ಮೆಡಿಕಲ್ ಬ್ಯಾಕ್ಗ್ರೌಂಡ್, ಅಗೇನ್ ಅ ಬ್ರೈನ್ ಟ್ಯೂಮರ್ ಇಸ್ ಅ ವೆರಿ ಸ್ಕೇರಿ ಥಿಂಗ್. ಸೊ ಎನಿವೆ ಇಟ್ ಹಸ್ ವೆಂಟ್ ವೆಲ್. ಓಕೆ, ಡೋಂಟ್ ಕ್ರೈ. ಈಗ ಚೆನ್ನಾಗಾದ್ಮೇಲೆ ಅಳ್ಬಾರ್ದು. ಹಾಂ, okay, you can, both of you give a thumbs up. Everything has went well.
Thank you.